Hello, welcome to the Shirley Contracting Bloodborne Pathogen Training. Please pay attention to what is covered and consider how it applies to the work you perform. So what are we going to talk about? We're going to cover means of exposure, response to exposure, best work practices, use of PPE, and vaccination options. Before we get into the training, let's take a minute and cover some definitions. This way, we can be certain that we all have the same understanding of what is covered. What are bloodborne pathogens? Well, bloodborne pathogens are infectious microorganisms that are present in human blood, and they can cause disease. For this training today, we are specifically referring to three pathogens: human immunodeficiency virus, HIV, the virus that causes AIDS, the hepatitis B virus, and the hepatitis C virus. Human immunodeficiency virus, HIV for short, is the virus that causes acquired immunodeficiency syndrome, or AIDS. This virus is transmitted from one person to another through blood-to-blood or sexual contact. People with HIV have what is called HIV infection. Hepatitis is an inflammation of the liver. It can be caused by drugs, alcohol use, or even certain medical conditions. But in most cases, it causes a virus that infects the liver. This is known as viral hepatitis, and the most common forms of hepatitis are A, B, and C. One other thing I want to talk about, and that's called occupational exposure. It is reasonably anticipated skin, eye, mucous membrane, or parenteral contact with blood or other potentially infectious materials that may result from the performance of an employee's duties. Parenteral means exposure other than through the gastrointestinal tract. Most common parenteral exposure are from needle sticks, human bites, or abrasions. Other potentially infectious materials are human bodily fluids contaminated with blood and other bodily fluids where it is difficult or impossible to differentiate between the bodily fluids, including but is not limited to untreated raw sewage, blood cultures, and other tissues. Another term you're going to hear is universal precautions. This is an approach to infection control. Per the concepts of universal precautions, all human blood and certain bodily fluids are treated as if known to be infectious. This is a better safe than sorry approach by treating all fluids as if they are infected. Exposure to bloodborne pathogens can occur in a myriad of ways. Healthcare workers and first responders have the highest risk levels as they are routinely in the presence of blood and other bodily fluids. However, a few activities which we perform have the potential for you to be exposed to bloodborne pathogens as well. It's also important to understand and recognize the difference between an exposure event and a contamination event. Simple exposure to a potentially infectious material does not necessarily result in contamination, and contamination does not automatically mean you are infected. For example, you're working in a sanitary sewer manhole and wastewater makes contact with your shoes or even your hands. Though the liquid may be contaminated, as long as you do not have exposed wounds or open sores, by proper hand washing and cleaning of your shoes and clothing, you can prevent infection. The training you are receiving today is very basic but important. Should you be assigned to a job site or a specific task that holds a higher than normal exposure level, you will receive training specific to the conditions and tasks you will be performing. Surely employees may be exposed to potentially infectious materials carried by wastewater when tying in new or isolated pipe systems, demolition of existing sanitary pipe systems, or working inside wastewater treatment facilities, working around items like bar screens, sludge holding tanks, or tertiary tanks. All of these areas provide the potential for an employee to come in contact with infectious materials, and the daily safe plan of action will highlight how to conduct work activities in order to minimize exposure. Now remember this, if an exposure occurs, first report the exposure to your foreman or supervisor. Let them know what the tasks were you were performing and how you were exposed. Secondly, wash the exposed area with soap and water. Any splashes to the face, flush them. Flush out the face, nose, mouth, or skin with water, or if available, use a facility emergency shower. Irrigate eyes at the eye wash station. And lastly, notify the safety manager. They will ensure employees get the proper care. By properly responding to exposure, you can reduce the potential of infection. Your best means for ensuring the contamination does not result in further medical requirements is by immediate treatment and reporting of the exposure incident. Let's talk about universal precautions. Because we can't see if human blood or other fluids are contaminated, and we can't see viruses that could be present in wastewater flows, it is important to conduct yourself assuming these substances are infected. That is what is meant by universal precautions. Treat everything as if it is infected until you can verify otherwise. Work practices play an important role in controlling the potential transmission of the hepatitis B virus as well as HIV. By performing certain tasks or altering and avoiding other behaviors, you can effectively reduce any risk of exposure. Such tasks include wash your hands with soap and water after removing your gloves and as soon as possible after exposure to potential bloodborne pathogens. If a clean water supply is not available, liberal use of a hand sanitizer is acceptable. Be careful handling sharp objects. Cuts and open wounds provide a path for the viruses to enter your bloodstream. Don't eat or smoke in the work area. Biological hazards and viruses can be transmitted from your contaminated hands to food or cigarettes. Tasks that present likely contact with bloodborne pathogens will require the creation, review, and implementation of a task-specific activity hazards analysis. Should engineering controls not be adequate to ensure no occupational exposure occurs, use of enhanced personal protective equipment will be mandatory and reviewed in the daily SPA. PPE is an effective means for protecting yourself if you follow these guidelines. First, specialized clothing and equipment worn or used by an employee is only effective if it is used 100% of the time. If provided, it is your responsibility to properly maintain and use the PPE. Clean and sanitize PPE after use. Reusing dirty PPE without properly cleaning it can result in an exposure incident. Make certain to remove PPE when leaving the job site and have an appropriate container to keep it in so you don't contaminate your vehicle or your home. If the PPE you're using is designed for one-time use, such as latex gloves, dispose of these at the job site in an approved manner. Never reuse single-use gloves, masks, Tyvek suits, or other similar PPE items. You may have heard of companies offering the hepatitis B vaccine and may have questions as to what options you have relative to potential exposures. The hepatitis vaccine will be made available free of charge and at a reasonable time and location to any employee at risk of exposure, unless the employee has had the vaccination, antibody testing reveals immunity, or the employee denies the vaccination. Declining the vaccination now doesn't necessarily mean you can't change your mind and get it later. Keep that in mind. Vaccination is voluntary and must be by an authorized, licensed healthcare professional. Now, in summary, OSHA's bloodborne pathogen standard prescribes safeguards to protect workers against occupational health hazards from exposure to infectious materials. Implementation of this standard can help prevent hepatitis B and C and will reduce the risk of workers contracting AIDS. The use of SPAs can help you identify potential exposure hazards, develop work practices to avoid or reduce those hazards, and, when combined with proper use of PPE, help you ensure no infection occurs. Lastly, should a contamination occur, by knowing how to properly respond, decontaminate the exposed area, and by reporting the exposure, you can both minimize the risk and prevent future exposures. Shirley Contracting is committed to providing you with a healthy and safe workplace. If you have additional questions, please reach out to your supervisor. Apply what you learned here today and ensure you and your team are healthy and safe every day. By understanding what the hazards and best work practices are, you will be best able to ensure your own health and safety.